All right. Hi, everybody. How are we doing? Can you hear me, Casey? Buffy, are you there? Hi, Tara.
Yes, how are you?
I'm doing pretty good. Good to have you guys here. We're going to give everybody about 5 minutes to pop on in.
Okay.
How are you, Tara? Oh, did she pop out?
Yeah.
Maybe her internet is a little funny. I don't think you guys can see my screen. I think I need to get darker markers or something. Maybe I just need better lighting. All right, let me take a look here. So while we wait for Tara to jump back on, it looks like she got kicked out or something. And we're going to wait for everybody to join in. We want to give everybody plenty of time, especially since we have a guest speaker today. We don't want anybody to miss out on anything unnecessarily, really quick, okay? So we're going to speak with Tara Rohus. She is a previous student of mine that graduated last year. And so I just thought it would be a really good idea that we all get together and kind of talk with somebody that we can relate to. Does that make sense? Right? Like I've had, other guest speakers and I brought them in and, they're all professional and they've all been in the business for a while. And sometimes it seems like, we take what they say with a grain of salt because we figure they know it all. Right?
Right.
And it's not from our experiences as if we were freshies, right? Or newbies. Okay. So I thought just inviting Tara here. There she is. She popped back in. Oh, I'm so excited to talk to you. I haven't seen you in so long.
It's been forever.
I know, you look so good. Congratulations.
Oh,
like tons of congratulations. I can't even congratulate you enough. I'm so super proud of you.
Oh, thank
we
you.
lost her again. Oh no, are you there? Oh,
Yeah,
there you are.
I'm here.
You just moved. So yes. So we're going to talk with Tara. And like I said, we're just going to get a real perspective. And like I said, she just graduated not too long ago. And so she's just like coming out of what you guys are getting ready to get into. Does that make sense? So I want you guys to ask her all the questions you want. Tara's awesome. She's going to go ahead and inform us as much as she can on a real level. I love Tara for this. We have a good rapport and she's real. She's just going to tell you how, you know what I mean, her experiences kind of a thing from a laid back point of view. Sound like a plan?
Yeah.
All right. So I would like for everybody to have their videos on. So my Ms. Rojas has an audience, and per PIMA protocol, we do have a guest speaker. So we would like to perform professionally today for me, please. And we'll go ahead and we'll get started here. I'll give everybody 2 more minutes. All right. Busy day today, huh, Tara?
Yes.
I bet. I can't wait to hear all about it.
Yes.
So if you're just joining us, like I said, we're going to talk with Tara here in just a second. And then I wanted to talk about your outside hours activities folder. I added that for you guys to keep you guys like a little reminder, maybe a visual every day to remind you to go to your outside hours. So that way, I know you guys got a lot of things going on. Maybe it's hard to remember. Okay. But I don't really see anybody doing a whole lot of outside activities that would really get you the information across in a different way and help you out a little bit. Okay, so just things that you can look into. There's no grades or anything. These are things that you do in your time or when you have time. Okay. And then I wanted to kind of cover chapter 35. It's only 12 slides long. I'm hoping to get it done really quick. But I have all these neat things pasted all over my board today. We're going to go ahead and take a look at some safety devices, okay, because we're talking about infection control and things that we do in order to be safe. And these safety devices is what we're going to talk about today and how we use those and what they prevent. And then there's different types of safety devices, right? So here's another one, another needle with another safety device to help prevent sticks in the office, okay? So that's what we're going to cover today. All right, so I'm gonna go ahead and get started. It's 7:05 now. Okay, so I would like to introduce everybody. Daisy, Antoinette, Casey, Buffy, thank you guys so much for joining in live with us, okay? We have Tara here today. For those of you watching the recording, Tara is now a CCMA, Certified Clinical Medical Assistant. Congratulations.
Yeah.
Super proud of you again. Okay. And she's fresh and wants to share her journey with us. So I'm just going to let Tara go ahead and take it and mute myself because my kiddo's in the back. Okay.
Okay, hi guys. So I started Pima. It was about a month after COVID. So I was at school for a little bit, and then I had to start doing it online, and it was very frustrating at first. But I just, stuck through it. In the classes, Miss Jaramillo is really good. So you guys have a good teacher as far as that goes. But so my main thing is for externship, I had to wait probably a good month and a half, 2 months almost, because there were so many slots open. Normally, they told me that they at least accept 3 to 4, and they only took 1. So, definitely a decrease. So my externship, the first day, I was entering in vitals and taking vitals. So that really showed that I was, wanting to do it.
Where did you get placed?
I'm sorry. So my site was the UNM Digestive Disease Center. It's not at the main hospital. It's a little clinic. So there are 1, 2, 3, 4. There was 5 MAs there. There were also 2 registered nurses, and then we also had the charge nurse, which is the supervisor. So it's a small little clinic, and then we have 3 or 4 clerks. So they always they check in the patients. They make sure that their insurance is up to date. More of the front office stuff. Make sure that their insurance is up to date, that they pay any co-pays that need to be paid, and then us in the back, we get the patients. Definitely just a lot of questions. I asked questions from day one. You're there as a student. You're not expected to know anything, really. I mean, you're there as a student, so you ask whatever you need to ask. Everybody, for me, they were very warming. It's what you get into it. What you put in is what you get out. If you ask a lot of questions and you want to be informed, then they're going to tell you. If you kind of lay back to the side, then you're really not going to get what you want out of it. What else? So what I did there, I was triaging. So getting all of their first information, verifying name, date of birth, of course, that's the first thing when you get a patient. And then you put them in a room, you room them, you take their vitals. So manually, I've had to do manually because in the clinics, they have the robos, but those aren't always accurate. I had patients that had really low blood pressure, and so I wanted to double check that. So I did manual, and I got a more accurate reading.
Was there a difference?
Yes.
I told you. You.
Yes. So definitely know that manual blood pressure is something that you're going to have to use sometimes on a daily basis. What else? So I triage them. Then after that, we make a copy of their sheet, the information that we get. We have to make a copy. That way we can give that to the provider right away. Most of the time, they're really fast. I had a provider. They had appointments until 2:00 in the afternoon. They were done at sometimes 12, because that's just how fast they were. I mean, super, super fast on top of it. That doesn't mean that they don't give the patients the right care. Sometimes they've been seeing them for years, so they don't need to spend that in-depth time with them. Not always. So that's that. So after you get your copy, you enter in your vitals. For students, mine had to be verified. You're still learning. You're using the real system, so you have to know that you're entering that in correctly. So you have you enter them, and then an MA verifies it, make sure that it's correct, and then they approve it, and it's in the system. So you also do that. After vitals are entered, then there might be another patient to room. So you have to go check that rack and make sure that there's no more charts, and make sure that patients aren't waiting. I had to triage everybody just because it was a little bit slower. Because of COVID, we didn't have a lot of patients unless they were really, really sick and needed to come in. It was Zoom meetings or phone visits right now.
Do you guys set those up? Did you get a chance to set those up?
So yes and no. There was sometimes links that we had to send the patients. 9 times out of 10, what we would do is we would instruct, so for a Zoom meeting, we would instruct the patient to either download Zoom or we would walk it through, we would give them the steps. And then there's a meeting ID code and there's a passcode that you have to give them. It's individualized between providers. These links are HIPAA safe. So normally, unless they've had the HIPAA clearance, then they won't have their meeting room yet because it is HIPAA compliant. That's the one big thing that I noticed, that there were some people that they were fellows that did not have a link. So we had to give them a different provider's link that would be seeing them because they didn't have that clearance yet. So that's Zooms. Phone visits, there were some things that we had to do. There's annual health assessments. If we saw a phone visit, automatically we knew, okay, I have to see this patient's chart and see if there has to be a health assessment done. It's done every year, 2 years, depending on whatever assessment it is. As an MA, I was required to do a health history assessment and then also a disease assessment. So any kind of diseases we would ask, any kind of health issues, whatever it is pertaining to them or their family. Some things are just genetic automatically. So let me think what else. So
did you guys do any procedures in your office?
Yes. So this clinic, it did have a clinic side and it has a procedure side. Most of the time, the same physicians that were on the clinic side scheduled their procedures. Well, we scheduled them, but for this clinic. Now there were
their
guidelines.
days.
Yes, they have certain days of the week, normally 1 to 2, that's all they do is procedures. I got to watch 3 of them.
Ooh, what'd you watch?
So I was able to watch 2 upper endoscopies. They stick the camera down the esophagus all the way in, and they see if there's any kind of polyps. It was so interesting. I was like,
was
oh
it
my
cool?
goodness. Yes,
awesome.
it was so cool. Yes.
So we're talking about right now with our chapter 35, what we've gone into in this course as far as like sterile fields. How did you set up your sterile field for that? What did they do?
So before you even walk in the room, there is a scrub station. You have to, for me, I just washed my hands, but the physician, the person that's going to be doing the procedure, scrubbed down. Yes. Because it's going to be in the face region, there were protocols. Obviously, you can't have a mask. So before they were even allowed back there, they had to have a COVID test to make sure that they're not putting the physician or anybody else at risk. In the procedure room, there's going to be an RN to make sure that they can monitor sedation levels. Also, they have a tech, an endoscopy tech. They assist with getting tissue samples. So they have a little, it's really, really tiny. It's like this big, but they clip inside to get little samples. There could be reasons why they're having trouble swallowing. They need to see why, if there's a blockage. There's all kinds of different things that are involved.
And did you see it on the video as it went down and cut and all that stuff? Yes. So there's a camera that the doctor is watching the whole time. It's magnified. So that way he can see whatever needs to be seen. Yes. Kind of gross, but kind of cool at the same time. I didn't know whether I get fascinated by that stuff. Yeah, they definitely, the people that were in there had been doing it a long time because they were talking about what they were going to eat for lunch after. So how did they drape the patient for that procedure? How did they lay them and drape them? So it would be, oh my God, I totally,
once I did the, honestly, guys, once I did the test, kind of the terms just went.
I told you
Um,
guys.
it's done. So they're gonna be laying down on
On their
this one.
back?
No, they're gonna be on their side. They need to be able to open up the airway correctly. So that's how they were for both of them actually. So for the endoscopy, it was on their side as well. And then I also watched a colonoscopy. There's preps included for those that are sent by us. And this patient didn't do the prep correctly. So the procedure still got done, but it was difficult. Whenever it's important for us as MAs, guys, to make sure that the patient knows what to do for this procedures, anything. There's breath test that was done at the office to test different bacteria in the gut to see if they were present or not. And if there's any kind of seasonings on their breakfast, then it can't be done. We have to reschedule, and it's a 2-hour test.
Oh my gosh.
Mm-hmm.
That's really interesting. So when you were at your extern, who did you report to?
So I reported to the charge nurse. She was the supervisor for the clinic. Every day when I came in, I would let her know I was there. She would mark me present. I had already clocked in on the app, or not the app, but on PIMA portal. There's a place when you start externship, it'll show you, to clock in, who you're reporting to, how many hours you have verified, all of that. So you'll be able to keep track of that as well. But I let her know that I was there. And then about 10 minutes later, we did morning report. Everybody got assigned who they were going to be with that day as far as physicians. We had screening procedures we had to do. So that got scheduled as well, who was going to be screening. Who we got told right away what time our lunch is going to be. So there's no guessing what time am I going to eat today, when you get there. Breaks are as is. When you have time to go to the bathroom, then you go to the bathroom. And, you have a 10-minute break, 15-minute break at most, depending on the busyness.
And then what kind of prep did you have to do? Did you interview for your extern site?
Yes. Well, so there was a mock interview towards the end of when you guys finish up with PIMA. It's exactly like how a real interview would be. And you get kind of like a score at the end of, if this were a job, what kind of, score would you get with them? And when I had my interview at UNM, there's actually a score sheet. There is 5 people. There was 3 of the MAs, the charge nurse, my supervisor, and then another nurse as well. So there was a lot of people.
Ooh, a panel.
A panel of people.
Those are always so intimidating. Who else thinks those are intimidating? I totally think those are intimidating. I don't know about anybody else. I've had 2 or 3 interviews like that, and I always get all my lips and I'm like, oh, did I put on deodorant?
Yes, it's definitely kind of stressful. I mean, I had only been there a week when I interviewed. This clinic had been looking for somebody, and I had actually noticed a few things that were very important. And
such as what?
Okay, so
I want to hear all about it. I haven't seen you in so long.
I know, I haven't seen you. Okay, so very important. When, like I said earlier, when the clerk checks in the patient, there's a financial, it's called a FIN number basically. And that goes into that specific visit for the money part of it. Who's getting paid, how much, that kind of thing. This is all being, the CPT codes, everything is for this specific number. Now, there was an issue where the paper didn't match the sticker. And that is very important to make sure that everything matches. When people verify information, it's not just to verify it and, waste breath. It's because if this patient is not what, who they are or who they say they are, then there's some issues. So this financial number wasn't the same. I went immediately to the supervisor and she said, okay, who caught this? She didn't, really know at the time. And I said, well, I saw it, that they don't match. And she goes, okay, she didn't really think it, say anything of it, but I know in my head that was a big thing. For day 3 of externship to notice that means that I'm paying attention to things that need to be paid attention to.
Bingo.
You guys
Awesome.
there's a
I
lot of
like
things to pay
that.
attention to, very much so. I know that Ms. Jaramillo is very big on critical thinking. Guys, it's just
Yeah.
using your brain. That's all it is.
Yes, or kind of thinking about that next step, or what is going to be the next thing that I need to prepare for.
It's kind of like driving in a way. You're looking at the light, you're making sure if you're turning,
That's
nobody's
good.
in the crosswalk. I mean, it's kind of like driving in a way.
Yeah, like defensive driving, when you look farther ahead and you're planning your turn, you turn signal, what are you going to have to do next, etc. Yeah, you're absolutely right. That's a good analogy. All right. Does anybody have any questions right now for Ms. Tara about anything that you're kind of worried about or concerned?
Sarah,
Mm-hmm.
how did you feel like from like going into the whole medical clinic? Like, how were you nervous?
So like
Were
when I
you-
got told about, so I had been waiting so long. So number one, I was excited anyways, because
Okay.
this is the last step, right? You know what I mean?
Yeah.
This is the last step to finish it. So I was just ready. So I was excited. I was nervous, of course. I mean, you're going into a totally new realm. I had never, really been in a doctor's office except for as a patient. So yes, it was, once I met the people, when I first walked in, the supervisor, she spent about an hour with me, just going over different things, showing me right away, this is, we gel in and out of the rooms. This is how we clean the rooms. There's certain wet times. When you start, cleaning the rooms, different chemicals have to be wet on the surface for so many amount of minutes. I mean, she was very thorough. So when she told me about those kind of things, it kind of eased me into it. I got a tour right away. I got introduced to everybody right away. This is our student. She'll be here for, however long you're going to be here. So it wasn't, nobody knew who I was or anything like that. I was welcomed right away. And that's how you will be too. They're going to make sure it's very professional and very, just a very good setting. I mean, all of the physicians within 2 or 3 days, they're going to know who you are as well. So I was anxious.
How was your first impressions with the docs when you met them? Remember I told you guys it's kind of funny to be talking to docs for like the first few
goodness.
times, right?
Okay, so there's going to be the ones that are very appreciative of you. They're going to be happy that you're there, because really they're very smart, but they couldn't do half of the stuff, guys.
Without you, right?
No, not at all.
Helpless.
Yes, like you guys are their backbone. So there's going to be some that are very appreciative of you. And then there's going to be some, literally, I was 4 weeks into externship, 4 out of 5 weeks before one of the physicians even said hi to me. Okay. So, and it didn't bother me at all. I just kept doing what I was doing because I'm not here for him. I wasn't there for him. I was there for me. So once he, okay, she's almost done, I think I'll say hi to her, but I think at that point they had known I was going to be working there. So, and you kind of just have to prove yourself. I got what I put into it, and that's what it was. I was asking questions. They do, so guys, for the people that have problems swallowing, there's different things that are done before the actual procedure. So for instance, there's a capsule endoscopy, or that. And
we just covered that, didn't we? Didn't I just cover that with you guys? Endoscopy?
Mm-hmm. Yeah.
Endoscopy, yeah, a capsule. So basically, instead of the camera, maybe they, because it's dysphagia, they have trouble swallowing. They maybe can't tolerate a big scope, even though it's still small. They might have some issues. So there's this pill, and it has a camera, I'm trying to see my finger. Okay. So it's about like this big. It's kind of thick, but I mean, nothing bigger than a vitamin, a big multivitamin, and they swallow it. And once it's swallowed, then there's a system that they have on them. We fasten it and connect it to them before they even swallow the pill.
And it records
so-
everything?
Yes, so it travels through and it records from the minute it's in your mouth to the minute it passes. The machine will let it will basically communicate with each other that the capsule has passed. What that means is, that's the main procedure. But before that, if they've had issues with like their bowels maybe not going the right way, there's a patency capsule that they do first. And basically it's like a chalk. And if that gets rid of, they do an x-ray basically. Well, I don't know if I'm saying it right, but they do a test to make sure that this powder is gone out of your system. And if it's gone, then that means that you can pass the capsule correctly.
So they have to make sure you're able to even do that before they can get you to swallow it, kind of a thing. Yeah, because that would be a big waste of time if it was never going to come out and give them the results that they needed.
This is supposed to be done within 24 hours. And normally if it doesn't come out after that, then there could be an issue. And if they start vomiting or, they're having some issues, then they probably should be seen right away. When I watched one of them, one patency and one of the regular procedure, and we did inform them if they start vomiting they don't feel right at all, they need to be seen because that is a foreign object in their body. So
you deal with bodily fluids and how do you dispose of your biohazardous waste? Because that's another thing we're talking about now too.
Okay, so very, very specific. There's only one bin that can be any kind of blood, vomit, feces, anything that comes from your body is in a red biohazard bag. We have a regular trash can in the rooms, and then there's also a red bin, a biohazard bin, and then the sharps container in every single room.
So where does that thing, you have to...
So there is somebody, well, for UNM anyways, there's somebody that picks that stuff up to be disposed of properly.
Oh.
There's somebody that picks it up, as well as there's a shred bin that we don't shred it. The paperwork goes inside the bin and they're locked. So nobody can even get in there after the paperwork is in there. Somebody comes and picks that up to dispose of correctly as well. Because these are patients' medical record numbers. They have their socials sometimes, very personal records that maybe can be used the wrong way. So we need to protect their information.
Oh, okay. Thank you.
But yeah, the biohazard, that's taken care of by, well, at least at UNM. I'm sure with bigger corporations like that, it's like that the same, where they have a company that can handle that kind of stuff, pick it up and dispose of it correctly.
Any other questions?
I know, because you have to do lectures still.
Oh,
I can go
I'll
on
talk
and on.
really fast. I can talk really fast. So
Yes.
I do have a couple of questions for you too. What sort of, did you have to do prep for your extern, like your immunizations or anything like that?
Yes. So, and
What do you
actually I have to do it now that I'm an employee as well. It kind of, when you'll know that everything's repetitive, kind of in the end, transition from extern to employment. So when I got signed with a site, I had to do a drug screen, I had to do a background, and then also the immunizations. I had some of them, so they actually drew blood and they'd call them titers. It basically tests if it's still in there or not, or how strong that vaccination is in your body. If it's not as strong, then you have to get a boost. Or possibly another shot if it's been too long. So I had to do that. Prep for extern was probably about 2 weeks, guys. It was a little bit of time because you do have to do a few things before you get started. The I'm trying to remember the process of the interview. I think the mock interview is pretty much at the end of your courses, maybe almost done, before externship type of thing. Then you'll have your mock interview. What else did we have to do? I think that's it. But yeah, there is some cost to the background and drug test, but I mean, it's worth it in the
So
long
like
run.
how much was your drug screen and background? Because they're all typically about the same amounts, guys.
Mm-hmm. One was about 70. I want to say that would be the background. That makes more sense. I
Usually.
paid about 110, 120 bucks for everything. Mm-hmm.
Okay.
So it's not too bad. I mean, relatively. And then there is, at the end, to make you certified, there's a test that you have to take to be certified.
That was going to be my next question. How did your test go? What was the deal with the test?
So so basically you go on a website and you make an account. You have to make an account first and make sure that you're able to take the test. And then you have to pay for it. You schedule it. I did mine at home. So basically
Nice.
how that went was I cleared off all of my desk. It was completely clear. My son was gone. You kind of have to have like no distractions. I mean, definitely if you have a room where you can do it, then that would be cool. But my office is kind of in the middle of everywhere. So that was nerve-wracking. So I did a pre-test. Oh God, there was so many pre-tests. Pre-test, study, Quizlet, all you can.
How did you like those websites I gave you?
Oh, I loved them. Yes. Whatever.
Did you notice the questions on the test?
Oh, between the pre-tests and the real test, I think I got about at least altogether with everything 50 questions or so that were on the test. And that's a lot, like worded verbatim, the same exact thing.
Use my websites.
Yes. There is also that. I mean, and honestly, guys, I'm not one of the ones that, obviously you can't do this, but study for 3, 4, 5 hours all at once. I just can't. So what I did was I studied maybe honestly a total of like a week and a half, 2 weeks, maybe 2 hours a day. Just looking over, reading, practicing. The night before, I know they say not to really do anything, but I did, there's a paid test that I did, a pre-test, and that was really close. I mean, really, really close to the test, and I got 3 tries. So definitely $20. I mean, worth it, big time. So the test, it was kind of weird in the beginning because they have to verify it's you and make sure that your space is all clear. There's not a lot of talking. It's not uncomfortable. I thought that this guy would be like staring at me the whole time. I didn't even see who watched me. You are watched. You have to make sure that your head is in the camera at all times. You show around your table, you show underneath your desk, I mean, everywhere. Because this is a national test to certify that you know your stuff, and you have to. I can't hear you. You're muted.
Oh,
there you
I'm
go.
muted. I'm muted. Yeah, and it's not made by Pima. Pima doesn't make this test.
No, so this has nothing to do with Pima. So my website that I did was the National Healthcare Association. Yeah, NHA. So this is they have a lot of tests, but it is national. So just know that you can work anywhere you would like to. That's the one good thing. I didn't know about this so much until the end because my job wanted me to be certified. That's one thing that I can say right now is that a lot of them are going to be certified medical assistants that they want, or CCMA. You could do CMA, you could do CCMA, but they want that certified in there.
So that first and second chapter that you guys do when your first class, when you come in, chapter 1, chapter 2, That's why we go over all those organizations, and that's why we go through the AAEMA, and that's why I have a tendency to show you guys a lot of things from the AAEMA. I took you guys on the website to show you the continuing education credits and where you can get certified. Okay,
Mm.
because unfortunately for Miss Tara and her professional sequence one, somebody must not have done that for her.
No,
Was it hard?
no. So it was not. I was so nervous. So there's a Facebook group with CCMA students, people in the medical assistant world, and a lot of people had said that they got their results within 3 to 5 minutes. They got an email, results posted, and they were able to see the results and know if they passed or not. Me, I didn't. So I took my test at 1 o'clock in the afternoon. That was just a little bit better. You can schedule it for a morning session. You can schedule it for an afternoon session, whatever time fits your needs better.
Mhm.
And so I took it at 1 and I was like, oh my God, I don't know, I failed. But in my brain, I knew that I did, but just seeing that confirmation, really, that's what I need. So I just, stopped looking at my phone.
How long did you have to wait?
So the next morning, by 9 o'clock, I had my results.
All right. And
Mhm.
here you are today. Round of applause.
Yes. So it's been a road, but it's worth it. So today I start my job on the 25th. So I graduated, goodness, December.
Oh, I
I
thought it
don't
was
know, like
November.
17th. I don't know, December 7th. It was before the holiday, and then January 25th I'll start working.
That's so super awesome. Are you happy with your program and your story, your journey?
Yes.
I'm so glad.
It's definitely worth it. I know that I was so frustrated. I mean, it was definitely a frustrating time for all of us in the beginning of this whole switching to online stuff. And a few people didn't stick it out, and I know that maybe that just wasn't the best time for them, but I had to, because in the end, it's, it was for my family. So I kind of just, I'm in this and I'm going to finish this. And it was hard. There was lots of yelling and frustration and not yelling, but in my
Miss
brain,
Hottamil's capital letters and emails.
Oh my gosh. So one thing that she might seem strict to you guys and hard and this and that, but honestly, that's what I liked the best. Now that at the end of the road, like, she makes you think to where you don't have to. I don't know if that makes sense or not, but all of those extra things that she makes you guys do, it's to where you know what you're doing and to where you can really help the patients when you get them. Because you're going to see some hard stuff sometimes, and you have to be able to know how to handle it without getting them hurt. Words are very important, and I know that she talks about that too. So it's definitely how you communicate with the patients, your energy that you give off. If you are looking at them like they're crazy because they just told you that they found a hemorrhoid, how are they gonna feel? I mean, really, like, I didn't think that I would be in GI and be like, oh yeah, I'm so intrigued, but really, you have to be just professional, and guess what, when you're with the patient, you're going to get some hard patients. I had to tell a patient to stop smoking a vape in there, and it wasn't tobacco vape either. I had to tell them to stop. He didn't remember who I was at the end when I went to go discharge him. And so literally. So there's those hard patients, and then you have the patients that come off mean at the beginning. This one patient, she had never had her hep shots before, and she needed them. So another thing that they did at this clinic was shot clinic once a week. So for our patients that did have hepatitis, we had to make sure that they get their vaccines. So there's a series of 3. And I know that Ms. Jaramillo has great resources for vaccines. I don't know if you guys have that, but keep that. Keep all of the stuff that she gives you. I mean it. comes in handy. You're on mute. Mute.
So thank you. So you think that everything that you did in your program, even though it was online, was very relative to what you're doing in the field,
Yes.
and it related to everything that you've experienced, at least
Yes.
so far?
Yes, so far. And I mean, being at home, it didn't make it any different, really. I mean, there's those open lab times that will open up. I don't know how the labs are working now, but there
Still
was
the
open
same,
labs
yeah.
that we can sign up for. And
Mhm.
honestly, I went like at least in the beginning to do blood draws. I was there every day because I know that that's something that's important. Once I got blood pressure a few times, okay, that's not something that you do need to know. But for me, it was simple because I had already done it priorly to PIMA even. But blood draws was very important to work on for me. And so at first they had us use the fake arms, and they had been worn out so many times from how many students, I don't know. So it was kind of tricky. And the instructor said, if you can get this vein, then you can get mine, because there's not going to be that strange pull, when you get the vein. Clean. Okay. One thing that I can make sure that you guys know about the whole safety thing right now, and different things like that, is those sharps. So number one, after an injection has been done, number one, you just cap it, or you don't even cap it. It's like attached to it most of the
Yeah,
time.
the little safety
And you
device.
yes, and you just push that against the table, or something away from the patient, obviously, and then that goes in the sharp right away.
So like when you go ahead and you do your injection, you hook this up, right? When you're done, like she was saying, you just grab a hard surface like the counter, and it closes. And then that way nobody can run the risk of getting stuck. And then you stick it.
So the importance of that, guys, is actually it doesn't have to do with the patient, so I won't say any names, but there was somebody that actually was in the process of probably getting trouble because they didn't follow certain things. And guys, this can get your credentials taken away. It really can. There was sharps in somebody's desk that worked there. So that means that they had to walk from the room to the desk with a needle. That's a no-no. No-no. Vials, that's a no-no. So we do keep the vials. I'm not going to say that the vials just stayed in the room, because we do need to take it to the desk to get some information from it. Normally we just take the sticker off and we put it on the sheet, and then we discard those. But there's no reason for 9 or 10. You should never have 9 or 10 vials in your possession, ever. So that's important.
Following the procedures of where the injections go, the vials, there's storage procedures, right? Because OSHA requires that we store them in certain areas.
One thing that I want to mention about the storage. So I won't even be able to use that right when I get started, because they have to take your fingerprints to have access to a system. And Nexus, yeah. So that way they know who got the medicine for what, and you will be putting the patient's name in there, so they will know that you were the one that got the medicine for this patient, this day, time, everything. It's locked. There's certain ones that are already preloaded. So we had some twin Rexes. Basically, it's 2 vaccinations in one. They call them twin Rex, and those were stored in the fridge along with most of the other ones. But yeah, I mean, it's very safe. There's certain things that have to be done.
All right, guys, any other questions? I'm trying to think of everything that you guys should know before you go to extern, so that way she can walk you through it really quick. But
I mean, it's really, Just make sure towards the end when you finish your guys' classes, just keep an eye on your emails, because a lot of stuff will start coming in through your email. And I mean, I still talk to one of the career services person today, just because, you know, they were so helpful. But you'll be guided along the way. I mean, if there's something that is missing, or, you know, something like that, then you'll be notified. And also one thing else, because I know you guys have to go, but at the end, there's for UNM, there was modules that we have to complete for them, knowing that we understand HIPAA and different things. If you guys don't do those modules, and it seemed hard to begin with because it was misinformation, and they trick you, because it's all about those critical thinking skills, is reading this email and can I do this? And it's not like a normal, oh, here's your lessons today. It was a very, you know, I had to read it a couple of times because they are different, you know, and different. There's 5 steps in one little sentence that you might miss. And so I know that one person actually in my group missed out on even going because they didn't complete those things. And it's all about, you know, communication as well. I didn't hear about something, so I called the actual person at UNM and they told me what to do. Oh, well, that's not valid anymore. And, you know, so just make sure you keep an eye on your emails and just follow all the steps, and you guys will be fine.
Well, I want to thank you so much, Tara, for joining us. You did not definitely have to take the time out of your day to come and sit with us. I am so grateful and glad that you did, though. It is, again, just so good to see your face.
It's been so long. Wait, after COVID, okay, let's see. I don't know, but we'll talk.
Well, I'm super happy for you. I want to wish you the best of luck with your future endeavors, and please keep in touch with me, okay?
Yes, thank you guys for letting me be a part of your class tonight.
Thank you.
All
You
right.
can go ahead and
Thank
dodge
you.
out, Chica. Enjoy the rest of your evening.
Thank you.
Okay, blessed, hun.
Bye-bye.
All right, guys. So we now have kind of an idea, something that we can relate to, okay? And I know that kind of went on long. So what I'm going to do is I'm just going to make your PowerPoint available for you, and you can read through the slides and you can read the notes at the bottom of the page, okay? And then just make sure that you read the chapter and see where it's equivalent. I will jump off here and I'll record myself, you know, doing the PowerPoint, and then I'll post that for you as well if you want to watch that later.
Okay, thank you, Miss Emil.
You're welcome. I hope you guys enjoyed our guest speaker. And if you watch later, let me know what you think.
What about the
Oh, the outside hours.
yeah, that one.
Yes. So go to your Blackboard. And as soon as you open your course contents, you see where it has our week 1 folder. Right above it, in between the picture and then the week 1 folder, it says outside hours activities. If you guys click on that, it's going to go ahead and it's going to show you 3 things. Your abbreviations list, okay? And it's telling you to use the resource tab to locate the link to make your flashcards and study those. Those are your outside hours activities. You need to study those so that way you can be ready for the quiz, right? And then, of course, read the chapters. These are all the chapters that are going to be involved that we're using. They're well ahead of time. I had them posted to the course content and I just moved it is all. Okay, read all of these chapters and take notes. If you want to go ahead and read the chapters as we jump into them, that's fine. This is, again, outside hours activities and for your study purposes. I also went ahead and put in all of the videos. Okay, these are all of the procedural videos that are tied to the procedures that you're going to have to get checked off this course. Okay, if you don't know how to go ahead and obtain these videos from McGraw-Hill, all you need to do is go to Blackboard, and then you're going to click on Tools, and then you're going to click McGraw-Hill Higher Education. And then when you get to McGraw-Hill, you're just going to go to the library. And when you get to the library, you're going to go to media files. It's on the left-hand side. And when you get to media files, you just type in this title or whichever one you want to watch. They're in alphabetical order, and you can watch those videos. They're about 1 minute or 2 long, but they give you directly the procedures out of the back of the chapters. procedural videos that go to the book. I think that'll help you guys a lot. Okay. And I don't want to assign them, and nobody does anything when I assign it. But like Tara said, use Miss Jaramillo's tips and you should be fine. Okay. I'm not going to force you to do these things. I can't want it more than you, but they're there. So every day I put a little reminder in your folder. Don't forget outside hours activities. So if you finish up early or you're just sitting on the couch, don't have nothing to do, watch a video, do some flashcards. Okay.
But the abbreviations aren't due. They're just
So
for,
I did not make it an assignment this time.
okay.
I went ahead and just gave you guys the answers. Okay. So you can study, and it just seems, I don't know, too complicated, I guess, to have to get everybody to do it in a certain time and then give everybody the answers and then give you all enough time to study that. Like your class participation just doesn't allow for us to do that. So I don't want to hinder those of you that are on it. Does that make sense? I can't see myself doing that. So I went ahead and gave you the guide. Okay. Make your flashcards, study them. Okay. But your abbreviations test, you will be tested on all of them, and it will only be 10 minutes long.
Okay.
Okay.
Sounds good. Okay.
So that's the weighing the difference of whether you know what I'm saying, look those things up and learn those things on your own. Again, I can't force people to do things, but I can make them thirsty. All right. I'll talk to you guys later. You know where to
Okay.
find me. Okay?
Okay. Thank you.
You're welcome. Have a great night, guys.
You too. Bye-bye.
Bye.